Think your nose looks crooked? Today, Beverly Hills-based Dr. Vranis explains what makes crooked nose rhinoplasty look beautiful or not. Stick to the end to learn why a nose made straight by rhinoplasty can still look crooked. Dr. Vranis, when patients say their nose looks crooked, what are they seeing?
Well, first of all, thanks for having me back again. I really appreciate it. And I enjoyed our conversation last time. I would say that that's a tough question because the tip can be crooked in relation to their lips, their eyes, or to the top half of their nose. So crooked, I think, means usually there's a discrepancy, there's a deviation, there's one part is a little bit off compared to something else. Now, the question is identifying what that something else is. And I think that's where you have to guide patients and realize or talk to them and say, okay, tell me, what do you mean by crooked or what do you see? And then together you will analyze the different features of the face. And then you'll start to point out these, oh, it's crooked. The tip is crooked in relation to the dorsum. Or, of course, the obvious ones are when, like, you get punched in the face and then your nose is crooked because it's an obvious C or S shaped deformity. Those are obvious. But the more challenging ones I think we're going to allude to and hint to, discuss and review a little later is those more nuanced crookedness, deviate, not necessarily the deviated nose, but the crooked based on a relationship to another facial feature.
Yes, my son, rugby player, crooked nose, deviated everything. Okay, that makes sense. During a consult, would it be beautiful or not to bring celebrity pics to show to a surgeon?
Super helpful. It does tell us that we're in alignment. So basically, if someone says, "Hey, I want a really, really straight nose at the end of the day," and then you say, "Oh, show me 3 photos," and they show you these like tiny, complete ski slope noses, you all of a sudden red flags have to go up and say, like, "Wait, hold on here. Are To me, this looks like a ski slope nose. Is this look like a straight nose to you or a ski slope nose?" And then you can kind of figure out what they mean by a straight nose or what they really, really want. So it's very helpful in that regard. Now, in the part where it's not helpful is that a lot of celebrity noses are highly filtered. They have 4 hours of makeup to contour their nose in a certain way that's just not realistic from a surgical outcome. So, from that standpoint, it's not helpful. But it is actually helpful in terms of having that conversation. It opens up the door and you say, "Oh, well, did you realize that the celebrity photo shoot went through 6 hours of hair and makeup? The lighting, there's like 12 lights on every angle to make sure they get the one picture where that nose and the other facial features look incredible." And so people then start to realize, like, oh, this isn't actually like something the way they walk around.
Ski slope nose, is that ski slope?
That's usually what people call the ski slope. So think of it when you're watching the Winter Olympics and they're going down the hill and they go up that pipe to then go do their tricks and flips. So that's usually when in the side profile, when people want a very scooped out nose or a ski slope nose, that's usually the keywords that they'll say.
Beautiful or not, planning a rhinoplasty to straighten the look of a nose by focusing 100% on the nose.
Oh, that's the first mistake. And a lot of people get tricked online in pictures and before and afters when it's just the nose. That's all you can see, and it might be a beautiful nose in isolation, but then when you look at it, it compares to or how it fits into the rest of the face. There's a lot of things that can fall short. So be careful if all you're seeing is pictures of like close-ups of like just the nose. You want to make sure you want to, or my philosophy at least is to make a nose that fits into your ethnic congruency, your ethnicity, your facial features, all that stuff kind of comes together in my mind as an artist and when you're trying to create a nose.
Beautiful or not, planning a correction based mostly on imagery of the front view of the nose.
That's impossible. So noses are a three-dimensional part, and so or three-dimensional structure. And in fact, in this is one of the hardest things of rhinoplasty is that when you make one change in one dimension, you're almost guaranteed to change it a different direction from a different viewpoint. And so you always have to consider it's like a game of chess when you're in there doing a rhinoplasty. You move and position the cartilage a certain way, but you have to, after every move, look at all three dimensions: the front, the side, the bottom view, and then say, okay, do I like it? Okay, I'll take it. Or you make an adjustment and you say, you look again, front, side, underneath, and you say, oh, it needs a little more change. You change it again, and then you look, and when you're happy with all three views, that's when you like suture it in place and make it kind of stick there. So that's the hard part. And so you can never analyze a nose just on one view, whether it's just the front, whether it's just the side, or just the bottom. You kind of need, in an ideal world, have all three work in harmony together.
During surgery, would it be beautiful or not to strive to move the nose closer to the center of the face?
Definitely. So yeah, I think there's, inherently as humans, when we see a symmetric face, we do subjectively judge it as being more beautiful, in quotation marks. Um, it's something that I think even as young kids, when we see symmetry in faces, it makes us smile, it makes us happy. It's I think a sign, a very naive way of thinking of health. A healthy face is a symmetric face. If you start to go into congenital disorders and birth defects and things like that, it starts deviating from a completely symmetric face. And so that's, I think, just in the back of our mind, where it's imprinted as we're growing up and even as we're born as like newborns, to look for things like that. Now, perfect symmetry is never, ever, ever achievable or attainable. Everyone's going to be a little asymmetric. And that app that was very popular, that little game that was like, I don't think it was called face tuning or something else, but you basically take a picture of yourself, and then in the app, it chops up your face directly in the middle, and then it does a mirror image of the left side and a mirror image of the right side. And then you look at these two pictures and you say, wow, these are two different humans. And so basically what it does is it really shows you just how different one side of your face is compared to the other, or it magnifies those little asymmetries. And because now you're seeing like two right sides and two left sides, then all of a sudden you can start to appreciate and say, wow, okay, the two sides of the face really are quite different. So, perfect symmetry, not possible. I think trying to get towards more symmetry is, I think, the goal. And I think this is what does make faces just look more beautiful after a good rhinoplasty. Or, when you post something and all the comments say, oh, wow, what a beautiful result. Oh, she looks more beautiful. She looks more rested. What a great result. It looks natural. It fits, things like that. I think people's minds are telling them that we're a little closer towards being symmetric.
I didn't really realize that we were just, kind of programmed to love symmetry.
Yeah. I think it goes back to biology, like if you think about it, it's all about biology and passing genetics. And so a more, symmetric, more beautiful, more healthy person is someone that you'd want to mate with to create, more babies that are also, symmetric and beautiful and healthy.
That makes sense. It's just primal.
Right. It's primal instinct. I think a lot of life we do is just driven by primal instinct.
Yeah, exactly.
Have you ever, out of curiosity, have you ever done that app game that I was describing?
I've not heard it. I thought you were going to talk about a different game where it blows out your nose or makes your cheeks, it makes you look different. But I'm going to look for that, especially if I can find my twin maybe that way, my twin.
Yeah. That might be an interesting way to put the segue or the picture.
I love that. That would be fun. I'm going to look for
Yeah.
that. Okay. Is it beautiful or not for a surgeon to correct the inside support structure of a crooked nose without changing the outside?
It's very difficult to change the inside without having any sort of external or exterior changes. Can it be done? Sure, especially when we're dealing with breathing problems like an isolated septoplasty, which is very deep inside. To correct breathing, that's easy to do. The next level up, or the next issue with breathing, in addition to severe septal deviations that affect airflow, is that you have internal valve collapse. So when you breathe in, this internal valve collapses in, and then it doesn't let air go through that side. And so what we'll typically do is take a little piece of cartilage from the septum, slide it into the internal valve to make it a little bit stronger and a little kick it out a little bit more. And that way then when you breathe in, it doesn't come in as much and it allows a lot more airflow to come in through that nose. But even in doing so, you do widen the nose a little bit. I mean, if we're going to be very, perceptive of it, it's not much. People still look very normal, very beautiful. It can be done. It's just that it does widen it a hair.
Is that what causes like drainage after? I saw a video today of someone who said, if you get a rhinoplasty, your nose is going to drip all the time. And she was sniffling and
No, that's actually one of these things where not everybody gets it. Some patients get it. Some patients, it's tough to predict who's going to get in. There's different etiologies of it. One is that if you think about it, any sort of surgery will disrupt the little nerve sensations that live in the mucosa. And so if they don't kind of wake up in time, or they stay numb, that basically they don't allow the brain to understand how much humidity is in the nose, and so the brain will then just overproduce mucosa, in which case then it run or mucus, that way then it kind of runs out and you have a runny nose. The other thing that can happen is you could affect some of the sinus passageways that drain into the nose and kind of just reroute the way they flow. Usually they kind of drain into the nose and then go to the back of your throat. You swallow them, never comes out from the front unless you're sick. And, during that time you have overflow and then you start getting the sniffles or you need tissues, things like that. So it does, some rhinoplasties, it depends where the work was done deep inside the nose, I think can affect some postnasal drip, and so that becomes uncomfortable, irritating, and a little socially awkward if your nose is always running and every 10 minutes you have to kind of get a tissue to wipe it. It's a little bit, it can be a little bit socially difficult to deal with.
yeah, that's not fun. So does that go away?
You can almost guarantee the first couple months, but while those nerves are waking up, that you're going to have some sort of either dryness or overproduction of mucus. So that is the temporary part of it is pretty normal. I think when it starts exceeding probably 6, 9 months, 12 months, and it's a little bit more permanent or semi-permanent, then it becomes more problematic. Um, I haven't yet, I knock on wood, I don't think any of my patients have yet to have that, but I have seen a couple patients and it's really tough to fix. There are different nerve ablative measures that can be done, where you basically cryotherapy some of the deep nerves to basically calm them down, that so you don't get that overdrive overstimulation of mucus production. It can help. I don't think it's a guarantee, but it could be worth a try, especially if it's very distressing for patients.
Post surgery, beautiful or not, tiny curves, minor asymmetries that still exist after rhinoplasty.
So I think we're entering an era actually where people want more natural. And again, going back to our earlier conversation about asymmetries, is that a minor asymmetry actually makes it more imperfect, and right, and then some people find beauty in these imperfections. And so I've had a couple patients kind of come and say, like, I want to leave a little residual bump, or I want to have a little bit of an asymmetry, so that it just continues to look more natural versus it being a very robotic, very perfectly symmetric nose. And I think we're just seeing a little bit of a shift in society now, that the patients are accepting of it and some of them are even desiring it. So I think it is beautiful to have it. I think if, rhinoplasty is a very difficult operation, and if there is an inadvertent imperfection, a lot of these things can be taken care of in the office. So if it is distressing to patients, if they say, I love everything except everything about this rhinoplasty except this one little thing, a lot of those things can be kind of taken care of very easily in the office. So trust the surgeons that you go to, go back to them, talk to them, and be honest and say, listen, I think this is an A minus, but if we did this, it would, in my mind, go to an A+ result. Can we do it? And it might involve just a tiny more rasping. It might involve a tiny little cartilage graft in the corner, something like that. And all of a sudden, like, the patients are thrilled, the surgeon's super happy afterward, and it wasn't a big deal whatsoever.
Can you address little asymmetries, maybe move from the A minus to the A plus without surgery?
So surgery is like a word that means like any sort of procedure. So technically it would be a small surgery, but it would be a little procedure under local in the office, takes 20 minutes. I mean, these minor things. I'm not talking about like, make a whole nother surgery day out of it, come to the operating room, go to sleep, just to address all the little things. So most little touch-ups and tweaks can be done in the office very comfortably, probably in under 20 minutes. Under just local anesthesia. Like you go to the dentist, they put a little numbing shot so you don't feel anything. You wait for the 20 minute for that numbing to kick in. It takes like a couple minutes to do it, and then you either like one stitch, or sometimes you don't even need a stitch, and you walk out, you have a little bit of swelling, bruising for the next couple of weeks, days or weeks, and then you're, back to normal.
Perfect. Great. It's amazing. It's a miracle.
Well, I think one of the comparisons that we kind of talk about it oftentimes in the office is that it's kind of like you're building a house, and you build this, you build the garage, you build the kitchen, you remodel six bathrooms, you have like, brand new roofs and AC units. And then at the end, and then it's time to move in, and you say, I hate the garage color. And so all that means is that you don't have to redo the house. You don't have to break everything down to rebuild it. You just say, okay, let's order some paint. And then, next weekend, we're going to sit there and paint the garage a different color. And now all of a sudden I'm thrilled. It's the same thing.
Can you tell us about one of your cases where there was a severe deviation and how you dealt with it?
So this case actually comes to mind. It's near and dear to my heart. I many years ago operated on a woman, and she, 5 years later, reaches out to me and says, "Hey, my son has an issue. He had breathing, deviated septum, breathing, disturbance. He went to a surgeon out on the, East Coast near them, and now all of a sudden the breathing's way worse. Is there any chance you could please see him?" And I absolutely adore this woman. I had to operate on her. She trusted me, and now it's like the next level of trust is to trust you with her son. And so they're from the East Coast. And and the irony actually is that he's in college, and he actually is in college here, like 2 hours away from LA. So for him, it was easy. She flies across the country. I look in his nose, and the one side on the inside is completely to the left side of the nose, like like complete obstruction. I'd never seen such a bad inside of a nose before. And we talked about it, and I said, listen, like, this is gonna probably require like a complete reconstruction of the septum. It's not easy to do. I'll definitely need a little bit of your own rib to do this, and let's do it. And so they thought about it, and they said, all right, let's go. So he's on his spring break. We had like a narrow window to schedule this surgery, this revision surgery on, and we do it. And when I opened it up, the whole septum somehow was like complete. It was like a right turn. It was like a complete obstruction of the airflow. And so take out the entire septum, rebuild it, put it back in, and use like his rib to add strength. And so one of the principles here is that, if you do the same operation twice when expecting different results, you're crazy. So I had to think of something different, something that the first surgeon didn't do, did incorrectly, or just, missed. And so one of the things in my mind was to just, add a good amount of strong cartilage for reinforcement. And so did that. A week later, we take out the splints. He takes a deep breath, and he starts crying. He's like, "Oh my God, I haven't like breathed this well in like years." And um we took the opportunity to address a couple other cosmetic concerns on the outside that were pretty minor. Especially as a guy, you usually don't want something. And he's like a normal college dude. He just wanted like a little bit of a like straightening, a little bit of like the tip being a little bit more refined, but nothing crazy. And kind of, I guess, nailed it. And he was so thrilled, took out the splints, the cast on the top, and he started crying. And it was just like he could breathe well. And then, I saw him a year later, and he's dyed his hair blonde. He's like living his best life. He's, put on like 10 pounds of muscle. He's like just completely changed. He's like a whole new person, and so confident. Comes in the second time for his follow up, with his girlfriend. And it was just like really, really nice to see. Like, one, he got confidence. Two, he could breathe again. And I mean, that was like one of the coolest, most rewarding things I could see. And then three was just the whole story of like, the mom trusted me with their little kid, her little boy. And I take that very, very seriously. And it's very meaningful when patients, send their family, for surgery.
Okay, so that brings us to our question we've been waiting for. Is it possible for a nose to become technically straighter after surgery and still look crooked?
So I've seen this a couple times. It's not common, but it is one of these trap doors that if you fall into it, in retrospect, you want to kick yourself in the butt. And basically, it's in patients where we've talked about asymmetry from right to left. What I want to kind of talk about is discrepancy from top to bottom. So if you were to put a dot right between your eyes, so that's the middle of the top of the nose, but it's the middle of kind of the bony structure of the orbits where the eyes are. And then you put a dot right in the middle of your lip, which would be kind of the middle part of the jawbone and the maxilla. Ideally, and in most people, those two dots are actually pretty straight. And so the nose that lives in the middle of those two dots, if it's straight, then it's also going to be straight relative to the face. Now, there's some people where their eyes are shifted a little to the right and their jaw is shifted a little to the left. And so when you make those dots, they're no longer straight, but they're like this. And usually what happens is that the nose itself is a little deviated to eat up the difference. And so if you look at just the nose and you straighten it, then it's going to look really off centered to the lip. Or if you straighten it the other direction, it's going to look really off center to the eyes. And so that's where you have to really be careful. And if you notice it, I mean, the first time I did it, I scratched my head. I was like, I don't get it. The nose is straight, but it looks off. And like, the patient also, and then a light bulb went off, and I was like, wait a second, it's straight relative to the earth, but it's not straight relative to the eyes and the lips. And since then, I've seen probably 2 or 3 patients where they've come and they say, look, my nose is deviated. And then we draw those dots, and the nose is actually kind of straight down between those 2 dots. And I tell them, I was like, if I straighten it, I worry that you're going to then notice that difference between the lip. And so we have a very serious conversation. Once she's pointed out to people, they're like, oh my God, I see, like a light bulb goes off in their head and they get it. And so what I tell them is that what I'll do is, instead of it being like very deviated like this, I'll bring it not straight, but kind of like halfway, in which case it's going to look a whole lot straighter to you. It's going to look normal to other people. But if we were to like look at it in a very objectively, say it's still not 100% straight, it's a little bit off, we're going to agree and say, yes, it's a little bit off, but it's nowhere near as deviant as it was, but it's also not perfectly straight. And that, I think, also looks the best.
Okay, so there is a solution for it. It's just not, you can't make it straight because the face is not straight.
What I will kind of tell people is that if, let's say, you're building a building, did I give this example last time? You're building a tall skyscraper, but the street isn't straight. It's crooked, or it's like, on an incline. One of the sides of the building has to be longer than the other to make the roof and every floor straight. And so it's the same way. It's like we have to choose where we're going to chew out some of the discrepancy. And so, doing maybe a little bit of deviating the bottom side of the nose is a better way to do that versus kind of like compromising on the front or the side.
That makes sense. More balance over straightness,
Correct.
really.
And it's a little bit like magic, like an illusion. Like, hey, look, the nose looks really nice from the side and from the front. But if you were to like look at it from the bottom, there's a little difference between the 2 nostrils. One's a little bit like, longer than the other. One's a little rounder. But you're kind of hoping that no one's really going to come up to you, shake your hand, and like immediately look underneath your nose and say, hey, wait a second, your nose is a little different from the underside.
Thank you, Dr. Vranis. This has been wonderful. You helped us understand that crooked nose rhinoplasty, you really need to take in like balance over perfection.
I think that's actually the best tagline I've heard, and I might steal it from you with your permission.
You may.
We're achieving balance and harmony over perfection.
Beauty Seekers, we appreciate you joining us here for this interview with Dr. Vranis. If you like the education we're sharing, please subscribe to Beauty Seek.
Does your nose droop when you smile? Today, Beverly Hills-based Dr. Vranis explains what makes droopy tip rhinoplasty look beautiful or not. Stay with us to the end and learn the one thing that can make a nose after rhinoplasty look fake.